Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, new diagnosis code for patients with type 2 diabetes in remission. Break and number 148, use lifestyle interventions to show no signs of type 2 diabetes for at least 3 months. There's a code for that, 11.a.break starting October 1, 2025. A new diagnosis code was added to the detailed list of codes used by healthcare providers, the remission of type 2 diabetes. The 2025 update to the Medical Codes Manual introduces hundreds of new codes, including the new Diabetes Code, E11.A. Doctors use these codes to describe medical conditions, bill and obtain insurance reimbursement. This new code officially distinguishes between managing the disease and successfully achieving a state of remission. The code is for patients who have a documented history of type 2 diabetes who bring their blood sugar levels back to a non-diabetic range below 6.5% for at least 3 consecutive months, without any medication or complications. Using the new code requires specific documentation by the healthcare provider. That documentation must include the word remission and explain how remission was achieved, according to the American Academy of Family Physicians. This explanation might include lifestyle changes, such as diet and exercise leading to documented weight loss, a specific weight loss program or interventions like bariatric surgery. The official ICD-10 guidelines also emphasize that using a vague term such as resolved is not enough to qualify a patient for the remission code, nor can the patient have any diabetes-related complications going on. The patient's recent A1C readings must be included in the medical notes, and the medical record must confirm they are not currently taking any diabetes medications. The American College of Lifestyle Medicine, ACLM, calls the new code and number 156, a major milestone for lifestyle medicine. And number 157, they note that type 2 diabetes impacts around 11.6% of adults in the US, with an increasing prevalence among younger people, and a hefty cost in direct expenses and reduced productivity less than /speak. ACLM said research points to lifestyle changes, such as a whole food, plant-based diet, exercise and sleep, as comparable to bariatric surgery, a common tool used to achieve type 2 remission, but without the potential for side effects. Sources: American Academy of Family Physicians, October 6, 2025. Disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. And copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. Read this next. FDA clears new blood test to help rule out Alzheimer's disease. And number 148, the U.S. Food and Drug Administration, FDA, has cleared another blood test that could help doctors identify whether a patient's memory. California to require food allergen labels on menus by 2026. And number 148, starting in 2026, restaurant chains in California will be required to list major food allergens on their menus in a first-of-its-kind law. Gov. Mom's voice boosts baby's speech development in the womb. And number 148, fetuses are eavesdropping on their mother's conversations late in pregnancy, with her voice providing an important boost to brain pathways. More news resources. MedWatch Drug Alerts Daily Med News for health professionals. New drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.